This is a natural dietary supplement extract from tropical sorghum bicolor, researched, refined and confirmed as a powerful antioxidant. It will increase your blood to required levels and boost your immune system rapidly. Jobelyn improves the fertility rate in both men and women. Jobelyn protects and provides energy for mother and child all through pregnancy and at childbirth. Jobelyn purifies your blood. It deters and effectively controls chronic heart diseases and blood-related conditions. Daily intake of Jobelyn protects the body from infections and guarantees a healthy and happy family. Jobelyn has no known adverse effects. Produced by Health Forever Products Limited, Dikpeolu Street off Obafemi Awolowo Way, Ikeja, Lagos, Nigeria. Available in sachets and capsules for adults and syrup for children in all leading pharmaceuticals nationwide. Consult your physician for prescription.
30 capsule Jobelyn now comes in a new pack.
Live healthy. Live Jobelyn.
The prevalence of diabetes mellitus (DM) in Nigeria is getting levels. Quoting a former vice-chancellor of the University of Benin, even younger people are suffering from a type of this disease, once referred to as adults' onset disease. Scientists now know that DM is not caused by consumption of too much sugar. Rather, they have noted a relationship between obesity and hyperglycemia, a condition when 100 ml of blood contains more than 120 milligrams of glucose. What could be the cause of this devastating disease, and why is it on the increase? Dr. Abia Okon comments on these points.
Diabetes mellitus. What first comes to mind when one is talking about this is the enormous quantity of sugar that accumulates in the bloodstream. It will be surprising to learn that sugar, which is the main source of energy for human beings, is considered to be a very dangerous substance. That is why the good Lord made it possible that this dangerous substance is evacuated as much as possible from the blood circulation and transported by a special hormone to inside the cell and within the cell into the mitochondria. Insulin, like I've said, is a hormone. That is, it is produced in the beta cells of the pancreas and transported without really going through a pipe, but is transported straight to the blood circulation and carried to the site where it is needed. Like I said, sugar is dangerous. It must be transported immediately from the blood circulation right into the mitochondria, where in the mitochondria, sugar is metabolized into adenosine triphosphate energy. Like I said earlier on, it is the beta cells found in the pancreas that produces this insulin. The pancreas is an organ found right behind the stomach within the abdomen. The beta cells produce this insulin, and while it does that, it generates a lot of free oxygen radicals. There is no doubt, however, that it is these same free oxygen radicals generated by these beta cells that finally turns around and destroys part or all of these beta cells. If these beta cells are partially damaged, the quantity of insulin as well as the quality of insulin produced is just partial. And therefore, we still have some quantity of insulin floating around. Then we have the type of diabetes called type 2 diabetes. In other cases, when the destruction of the beta cells is total and complete, no one single insulin is produced. In such cases, not a drop of sugar is transported from the bloodstream to the mitochondria. All the sugar remains within the blood circulation, causing the very deadly type of diabetes called the type 1 diabetes, which we find in newlyborns.
High blood cholesterol seen in obesity disturbs insulin function. Quality of beta cells depreciates with age. Low quality, defective beta cells which produce low quality insulin could be inherited. All these could end up with diabetes mellitus. But what other factors could cause diabetes mellitus?
This goes to one, the alcoholics, because the beta cells are embedded within the pancreas. And anything that goes wrong with the pancreas will definitely affect the functions of these beta cells. In cases of pancreatitis, a condition found mostly in alcoholics, quite a handful of these beta cells are destroyed, or at least their functions are hampered. Therefore, in cases of pancreatitis, we have conditions where the insulin production is hampered. Either the quantity is reduced or the quality is reduced. Not just that. We talk about conditions when we consume too much of processed foods. We consume foods that contain too much of chemicals. In such cases, this directly or indirectly affects the production of insulin by these beta cells. And of course, in life, consumption of the modern type of foods that we consume, which contains quite a lot of free oxygen radicals. These free oxygen radicals, in fact, does something. They destroy a very high percentage of these beta cells, leading to the same thing, the poor production of insulin or the poor quality of insulin produced.
Because of the overwhelming thirst, the diabetic patient drinks so much water and urinates so much. What else do we observe in a diabetic patient?
The devastating direct effect of sugar on the tissues. We find that when sugar acts on the lens of the eye, it causes dehydration of the lens and therefore leads to blurred vision in the individual. That is why diabetics find it difficult to see in the night. Secondly, the direct effect of sugar on the vagina, for example, encourages the growth of Candida albicans. That is why people who are strongly diabetic suffer from vaginal thrush. Apart from that, let's look at the indirect serious effects of high blood sugar. Number one, the sugar that we are talking about floats around in the bloodstream, but because there is no insulin, it is not capable of entering into the mitochondria where the sugar will be turned into energy. So you have in diabetics conditions where you have a lot of sugar floating around in the blood circulation, but unfortunately cannot get into the mitochondria to produce energy. What do we notice? We notice that such people have low energy production and they are always very weak. Because of lack of sugar within the cells themselves, you notice that the cells don't develop well, especially the muscles, that is the muscular tissues. As a result of that, the patients tend to lose weight. When this sugar is high and flowing in the bloodstream, it causes a devastating effect on the inner lining of the capillaries and the blood cells, that is the endothel. And when the endothel of capillaries and arteries are destroyed, the blood vessels themselves get destroyed. And this is one of the reasons why diabetics who have destruction of the cerebral, that is the brain blood vessels, suffer from stroke, because the wrinkling of the endothel, that is the inner lining of these capillaries, leads to blockage of these blood vessels and therefore leads to stroke. Of course, a similar thing does occur on the retina of the eye. What happens there is that the capillaries, that is the very tiny blood vessels, are blocked by the direct effect of the sugar on these little blood vessels. As a result, these blood vessels in the retina are blocked, and as a result of that, blindness occurs. Similar things occur in the coronary blood vessels. These are the little blood vessels that supply blood to the heart. And when these are wrinkled and blocked, there is insufficient blood flow to the myocardium. The result is heart failure. Of course, the popular consequences of diabetes, which is always evident in most cases, are the amputation of the limbs. The cause is very simple. The same thing happens to the blood vessels that supplies the limbs. And when there is the end result of blockage of these blood vessels, the blood supply to these limbs being blocked causes the necrosis of the death of these tissues, and the end result will be amputation of these limbs. So you will see that the destruction of these blood vessels, because of the damaging effect of sugar on the blood vessel, leads to the insufficiency of blood supply to the tissue, and in the end, the necrosis and death of this tissue. It is not surprising also that insufficient blood supply to the ovaries, to the testes, also lead to the infertility in the male and the infertility in the female. But talking about consumption of whatever, you must have noticed during the presentation I've been making that I have always emphasized the consumption of balanced diet with plenty of antioxidants, because the damage that has been noticed in the beta cells has been noticed on the genes. And the damages to the genes have been found to be caused by free oxygen radicals. And we know very clearly from recent researches that the mopping up of free oxygen radicals clears the way to the damaging substances. Therefore, the best solution in my view to the prevention of diabetes, and at least to the assistance towards the generation of very good beta cells, will be first and foremost the administration of balanced diet that contains a lot of antioxidants. And there is nothing better in my mind than the suggesting of an inclusion of Jobelyn in our diet. So it's as simple as ABC. Introduce a lot of Jobelyn into your diet, even if you inherited faulty beta cells. On the long run, the antioxidants in Jobelyn will assist in the sustenance of good quality beta cells that will run up in the end to produce good quality insulin.